sometimes because you can interact a little bit more. Normally I don't have big slide presentations, particularly for smaller groups, so we can sit down and do more of a round table. So please feel free to ask questions, interrupt me at any time, and I'm going to warn you, I will get ahead of my slides and I'll kind of bounce around a little bit. But if there's anything that jogs your memory or makes you a little bit more curious about something, please ask, because I may skip over something or just barely touch on a subject that you want to know more about. What I'm primarily going to focus on this afternoon is just a big overview of breast cancer, some of the technology, some of the statistics, and what's coming up in technology and that sort of thing. As you know, breast cancer, I hope you know, it can occur at any age. Typically, it's going to increase as we get older, obviously, but I don't know if y'all remember the big study that came out last year, the health reform that came out and said women in their 40s don't need mammograms, they need to start screening in their 50s. Just because we don't find and or save many lives from screening women in their 40s. And I think their statistics was 1 out of every 1,200 women will be diagnosed in their 40s. Okay, fine. But what if you're the one person in her 40s that is diagnosed? I mean, to me, that just was kind of ridiculous. So they've come up with a couple of other studies, one done in Sweden, one done in Norway, that have kind of refuted that information. So hopefully we're going to overturn it. Because diagnosing women younger with breast cancer, the cancers tend to be a lot more aggressive, and the women tend to have young children at home. And they haven't lived the life that some of the older women have. Now, is that better or worse? It depends on who you ask. But 1 out of 5 women will be diagnosed in their 40s. To me, that's a pretty big percentage. And only out of those, only 20 to 25% are hereditary. So most people think that breast cancer is hereditary. I mean, you're going to get it because my mom has it, or my dad had it, or my grandmother had it. No, not really. 75% is not hereditary. It just happens for whatever reason. And you don't carry a gene or whatever. Overall statistics, 1 in 8 women will get breast cancer before they're 85, and it's only to lung cancer causes the cancer deaths in women. However, that being said, the mortality from breast cancer has been going down since 1990. In fact, the mortality since 1990 has decreased by about 1/3, and it's continuing to decrease over time, particularly in the younger crowd. About the statistic here is about 3% if you're below the age of 50, and about 2% if you're a little bit older. So obviously something is working. Now, mammography is not perfect, but it's the best thing we have right now to save lives. And through screening with mammography, with all of the new treatments that we have out there, I think that's what is actually contributing to the decrease in mortality from breast cancer. One great thing, there's over 2 million survivors out there now. What does that mean? Well, that means that we're actually probably detecting these cancers earlier, and the treatments that we're using is doing a world of good. Hopefully these are advancing. I'm not paying attention. So the key to breast cancer, or diagnosing breast cancer, is early detection. And what does that mean? That means you're doing all you can to help either prevent it and or detect it early when it does show up. By doing that, you're going to want to do 3 things, and they all work together. One's not better than the other. They all play a role together in order to help diagnose. And that self-breast exam, which you should be starting in your 20s, and I know we've got a couple of younger girls in here, so you should be doing your breast exam, and the American Cancer Society says to do it once a month. I say do it every day. And you say, oh my gosh, I don't want to do that. Dang, I don't want to, it's kind of bothersome. Well, some of the best advice I got when I was a medical student, I was scrubbed in with a surgeon. We were doing a breast cancer surgery, and And he asked me, how often, you know, how they do. I know y'all seen those ER shows and stuff, and they're grilling the medical student. And he said, well, how do you diagnose breast cancer? Well, mammography, that's all I knew. Because what about self-breast exam? Oh yeah, we do that, you know, once a month. He goes, do you do it? No. Why not? Well, I don't really know what I'm feeling for. It's lumpy bumpy, and I don't know what was there last month, that was there or this was there. And he said, exactly. You do it every day. You get the lay of the land, and you look for change over time. So yes, we're all lumpy bumpy. We all feel kind of weird doing self-breast exams. But you're always in the shower every day, whether it's morning or evening, and you're soaked up. It's very easy to do, to fill in there, and what you're feeling for is not necessarily the lumps and bumps, a change, something that wasn't there yesterday, or something that is starting to hurt that wasn't hurting yesterday. And then you can look at yourself in the mirror and look for any other signs or symptoms, which I'm going to go over in a minute. I'm not going to get ahead of myself. So the breast self-exam, I tell women all the time to do it daily, but if you can't, do it once a month. Clinical breast exam also is very, very important when you're at your doctor's office, and normally that will start in the 20s and at least every 3 years, starting in the 20s and then yearly as we get older into the 40s. And then obviously mammography. And this is just a little showing you how often you should be doing this breast or the physical exam. I'm sorry, I think I mistyped this one, but this is the physical exam from 20 to 40 every 3 years, and after 40 you should be having your doctor examined every year. Early detection mammography, like I said, is not perfect. We miss probably about 15 to 20% of cancers just by mammogram alone. It is still the best thing we have right now for screening. And there may be something that comes out that replaces it, but right now, for the low dose radiation that we use, this is definitely the best test. And again, remember in your 40s, there's still about 1 in 5 that are diagnosed. Some of the risk factors I listed here, family history again plays a part, but it's not the whole picture. Early menopause, early menarche, late menopause is a contributing factor, and you're asking, well, why? You know, well, what they believe is that if you start your period early and or have a later menopause, your body is exposed to that estrogen just that much longer. So kind of like hormone replacement that came out a few years ago. It says it increases your risk for breast cancer. It's the same idea. You're exposed and or your breast is exposed to the excess estrogen for a longer period of time. Also, healthy eating, you want to do that. You know, obviously alcohol use in moderation, and even smoking can contribute to breast cancer. That was one of the things I was going to say. Oh, the pregnancy. If you have a baby after age 30 and or never have children, again, it's the same idea with the exposure to estrogen, just that much longer. Same with breastfeeding. When you're breastfeeding, your hormone levels are very static. They're very calm and not fluctuating. So breastfeeding also helps reduce the risk of breast cancer. High-risk patients. We do have systems, there's tons of different algorithms we use to assess patients who might be high risk. If you're high risk, it's considered an increase of about 20% of getting breast cancer over a lifetime. And there's ones you can find on the internet. The most common is called the Gale model that we use, and you just basically, it's a slide ruler, and or on the internet you just click and answer questions. Who has breast cancer? When did you start your period? Have you had a baby? All that kind of stuff. And it'll give you actual lifetime risk of breast cancer. If you are in that higher risk group, we're going to probably start screening you earlier with mammography. Somewhere probably around 30, depending on what your risk is, instead of starting at age 40. And also we can include breast MRI, which is very, very sensitive in picking up cancers. And the younger you are, typically the denser your breast tissue is, which does make mammography a lot harder to read. And so that's kind of why we add that MRI in as an adjuvant to help with the diagnosis. Now, if you are moderately increased risk, this is that gray zone. This is the one that's about 15 to 20%. Of course, you are increased risk, but as of right now, there's not really any excess screening protocol. Insurances don't pay for the MRI, which is a very expensive test. I think things are going to change over time. Hopefully, we don't know a lot about the healthcare right now, but hopefully it will change over time. Okay, here are some of the signs and symptoms that you should be looking for. The most common is going to be a lump, and what you'll feel typically if it's cancer, it's going to be hard, it's going to be fixated, it doesn't move inside the breast, unlike a cyst, which is typically, it'll feel hard, but you can move it around, almost like a little rubber ball inside the breast. And there's other benign things that will also move around. Does that mean cancer doesn't move? No, it doesn't mean that. But on the typical feeling a lump, it's going to be a little bit harder and a little bit more fixed. And it's sometimes hard to tell it apart, but obviously if you find any lump, that's when you go to your doctor. Other things, inversion of your nipple. If your nipple has always, I'm just going to use layman's terms, is sticking out and all of a sudden it's not anymore, it's inside, that is something that needs to be addressed with your doctor. And the reason being, in kind of with the skin dimpling, like if your skin is poking in, or if there's a little indentation into the skin, what happens with cancer, it sends out these little hard tentacles, almost, for lack of a better word, and it pulls against all of that normal tissue in there. So if it's close to the nipple, it's going to pull that nipple in. If it is close to the skin, it's going to pull your skin in. And the best way, and the most common way for women, is if they're in front of the mirror and they stand up and stretch their arms out, you can see the dimpling. I mean, it's obvious. So if you notice anything like that, or your breast turns red, probably the most common cause for the redness of the breast is a mastitis or an infection. And they will put you on antibiotics for it. If the redness does not go away, then at that point they'll probably work you up for an inflammatory breast cancer. I can talk a little bit more about that later. I'm just going to kind of get through this real quick. If you notice a big increase in one breast versus the other, for whatever reason. If you notice veins, we all have veins that run through the skin, and I don't know if you can see yours, but sometimes with breast cancers are very, very vascular. That means they have tons and tons of blood flow running into them, because why? They need those nutrients. They send out all these enzymes, and they get these weird abnormal vessels that run in there, and they leak, and they absorb everything. Well, that blood's got to get out somehow, and they travel through your veins to go back to the heart.